think like all conversations with patients, one has to individualize, one has to be sensitive to the patient's anxieties and needs. But as we get to know a new patient with a cancer diagnosis, we need to create an open dialogue, a level of trust, and we need to help establish what those ground rules are. You wouldn't talk to a person in normal conversation about their bladder function or their bowel function, but yet that's going to be part of the relationship of a doctor and a patient. We need to open those barriers. Similarly, talking about money is very personal, and it's different than most relationships where you wouldn't immediately ask somebody, are you concerned about cost? Let me warn you that this is an aspect of your life that's going to be influenced by finances. We know that it's expensive to be a cancer patient. We know that insurance has its limits, and those limits may vary depending on the person, the insurance, and the course of the treatment. So facilitating a degree of discussion early and making it okay for the patient to share his or her financial concerns with you is, I think, a very important part of establishing a comfortable doctor-patient relationship for that patient. Now, I hear many doctors say, I'm not comfortable talking about finances. I don't think that's a luxury we can afford ourselves. Our job is to provide information and access to information that our patients need, and to facilitate our patients giving us the information we need to help make decisions in their best interest and to help make recommendations that they need to hear. So we've got to get over this societal taboo that everything we do is above consideration of cost, and cost should never be discussed, because that never was realistic. But it's become completely unrealistic in the era of very high cost medicine and very high cost drugs.